Hello everyone. So in this session of Poori Tarah Rato, we will discuss 10 to 12 important tables. So एग्जाम से पहले सबको गट फीलिंग आती है कि ये टेबल इंपॉर्टेंट है या ये क्वेश्चन आ सकता है. सो ऐसे ही मैंने अपनी गट फीलिंग के अकॉर्डिंग ये 10 to 12 इंपॉर्टेंट टेबल्स बनाई है. सो लेट्स सी इनमें से कितने क्वेश्चन एग्जाम में आते हैं. बट यू शुड रिमेंबर ऑल दीज टेबल्स क्योंकि ये सब बहुत इंपॉर्टेंट एंड मल्टीपल टाइम्स पास्ट में भी आ चुके हैं. ओके. So first of all, we have this FAB classification of AML in which we have M0. So M0 means undifferentiated cells. Okay. And these will be myeloperoxidase negative and myeloid markers will be positive here. Then we have M1 that is myeloblast without maturation. Okay. So there will be some evidence of granulocytic differentiation here. Then we have M2 in which there is myeloblast which matures. So myeloblast with maturation. And maturation at or beyond the promyelocytic stage will be seen here, and some OR rods will also start to get seen here. Okay, and translocation 8 to 21 याद होता है तो ठीक है, otherwise it's okay. So translocation 821 is seen here. Then we have M3. So M3 is very important. One thing is it has the best prognosis. Okay, then promyelocytic cells are seen here. That's why it is also known as APL or APML. Okay, acute promyelocytic leukemia. Then translocation 15 to 17, which is also known as PML RARA mutation. ये translocation is seen here, and यहाँ पे OR rods सबसे maximum होते हैं. Okay, so maximum OR rods are seen here. That's why since OR rods are maximum here, OR rods are granules of neutrophils. That's why DIC के सबसे ज़्यादा चांस भी यहीं पर होते हैं M3 में. Okay. Then we have M4, it is myelomonocytic. M4E is myelomonocytic with bone marrow eosinophilia. Then we have M5 that is monocytic. Then M6 is erythroleukemia. And M7 is due to megakaryoblast. Okay. And M7 की important बात है कि M7 is very commonly seen in patients with Down syndrome. Okay, and GATA1 mutation is associated with Down syndrome. And if AML M7 is seen in association with Down syndrome, then again it has a good prognosis. Okay? Then this CF classification. So ये classification जब मैंने नीट पीजी का एग्जाम दिया था तब भी पूछी गई थी, जब मैंने यूपीएससी सीएमएस का एग्जाम दिया था तब भी आई थी, एंड आईएनईसेट के एग्जाम में भी आई थी. Okay, then we'll discuss about this. So C for clinical manifestation, E for etiological, A for anatomical, and P for pathophysiological. Okay, so C, we'll discuss first about C. So C0 is no visible or palpable signs of venous disease. Then C1 में there are telangiectasias or reticular veins visible. C2 में varicose veins आ जाते हैं. And C3 में edema will be there in association with varicose veins. Then long standing varicose veins and edema होगा तो वहाँ pigmentation start हो जाएगी, that is C4A. The most important here is C4A. Then C4B, long standing pigmentation में sclerosis develop होने लगती है. So lipodermatosclerosis और atrophy blanchard भी जिसको बोलते हैं. Okay, this is again very important. Then C4C is corona phlebitis. Then C5 is healed venous ulcer and C6 is active venous ulcer. Okay. Then etiological में we can have congenital, primary, secondary or no venous cause identified. Anatomical में we can have superficial veins involvement, perforating veins involvement, deep veins involvement, and no venous location identified. Then physiological we can have reflux, obstruction, both, or no venous pathophysiological cause identified. Okay. Now another important table is heart murmurs. Okay, so we have systolic murmur as well as diastolic murmur. In systolic we can have holosystolic or pansystolic murmur, and we can have this mid systolic, which is also known as ejection systolic murmur, which is crescendo decrescendo in shape. Okay, now holosystolic murmur, if heard on the left side of the heart, can be because of mitral regurgitation, mitral valve prolapse, and VSD. If it is heard on the right side, then it is because of tricuspid regurgitation. Okay, then Ejection systolic murmur, if heard on the left side, can be because of aortic stenosis, can be a flow murmur, or can be because of HOCM. While if heard on the right side, then it is because of the pulmonary stenosis. Okay. Now you will tell me in the comment section that how can we differentiate between the murmur of HOCM and AS. Okay. Now diastolic murmur can be decrescendo crescendo or decrescendo, or we can divide it as early diastolic and this is mid diastolic. Okay, so early diastolic decrescendo murmur, if heard on the left side of the heart, is because of aortic regurgitation, while if heard on the right side, it's because of pulmonary regurgitation. Okay, if this decrescendo crescendo mid diastolic murmur is heard on the left side of the heart, then it can be because of mitral stenosis. One, it can be a Austin Flint murmur of AR, or if heard on the right side, then it can be because of tricuspid stenosis. Okay, we have another murmur in PDA, that is a machinery murmur or a continuous murmur. So these murmurs are very important and definitely one of them will be asked in the exam. Then IPCs बहुत important है, but we'll not be discussing it here. सबके पास अपने tables हैं IPCs की, सबको पढ़ने हैं. One IPC जो मुझे सबसे important लगता था अपने time पर भी और अभी भी is perjury. Okay, now you will have to tell me in the comment section that which is the IPC of perjury. एंड माइलस्टोन्स भी सबके पास है अपने नोट्स में, तो माइलस्टोन्स अच्छे से पढ़ने हैं, क्योंकि एक आईपीसी पक्का आएगी और एक माइलस्टोन पक्का आएगा. ठीक है. माइलस्टोन में भी जो मुझे अपने टाइम पे सबसे इम्पोर्टेंट लगता था बस कि ट्राइंगल बच्चा कब बना लेता है और स्क्वायर कब बनाता है. ओके, तो इसको तो अच्छे से याद करके ही जाना है. ओके, देन we have this new class of drug that is PCSK9 inhibitor. ये भी काफी important है and has a great probability to be asked. So PCSK9 act कैसे करती है? It targets LDL receptor degradation. Basically PCSK9 जो प्रोटीन है वो LDL receptor को डिग्रेड करेगा. Now अगर हमने PCSK9 को इनिबिट कर दिया तो LDL receptor डिग्रेड नहीं होंगे तो ज्यादा अपटेक होगा और LDL बॉडी से अपटेक हो जाएगा इन द लिवर. ओके, सो LDL lowering is very potent. 40 to 65% तक LDL कोलेस्ट्रॉल लोअरिंग कैपेसिटी है इसमें एंड सस्टेन्ड इफेक्ट रहता है थ्रू 1 year of follow up. Okay, now we have two PCSK9 inhibitor. One is evolocumab, second one is alirocumab, and both are FDA approved. But one drawback is PCSK9 inhibitors are very costly. Okay. Now, these two fractures are also very important. One is Smith fracture, one is Colles fracture. Colles fracture is also seen in osteoporosis. Okay. Now, Smith fracture is flexion fracture of the radius, while Colles fracture is extension fracture of the radius. Now, you will have to tell me in the comment section that which deformity, name deformity is seen in Smith fracture and which name deformity is seen in Colles fracture. Okay. Medial medullary syndrome is again very important. It is also known as T-Chilin syndrome. Okay. Now medulla, I suppose, is like this. So medial वाला portion क्या है? Medial वाला portion क्या है? तो let us see क्या क्या चीजें जाती हैं. तो medial part में one thing is motor symptoms आएंगे because of pyramids या pyramidal tract involvement. तो क्या होगा? Contralateral hemiparesis होगी. तो suppose ये medulla है. So अगर एक साइड का मीडियल वाला पार्ट चला गया तो कॉन्ट्रालेटरल हेमिपेरेसिस होगी. वन थिंग. और up to 50% patient can have contralateral facial nerve palsy as well. Then we can have sensory symptoms because of the involvement of medial lemniscus. अब medial lemniscus में क्या जा रहे होते हैं? Posterior column के fibers. तो posterior column के fibers involvement होगा, then paresthesia can be there. Proprioception and vibration loss can be there. Okay. Then 12th nerve paralysis can also be seen because 12th nerve is medially located. 9th, 10th, 11th are lateral. Okay. So 12th nerve, as we all know, is a hypoglossal nerve. So there can be tongue paralysis or dysarthria can be there. Okay. Then prognostic factors in ALL. I personally believe that this is very important. So favorable क्या है और unfavorable क्या है? WBC count less than 10,000 is favorable, or more than 20,000, some textbooks say more than 50,000 is unfavorable. Age between 2 to 10 is favorable. Less than 1 extremes of age is unfavorable. Then female gender is favorable. Male gender is unfavorable. White population is favorable. Black is not favorable. Note liver splenomegaly, ये सब इन्वॉल्वमेंट है तो इट्स अनफेवरेबल. नहीं है देन इट्स फेवरेबल. टेस्टिकुलर इन्वॉल्वमेंट है तो फेवरेबल नहीं है. नहीं है then it's favorable. CNS involvement again, if there then it is unfavorable. If it is not there then it is favorable. Okay, so ये तो conceptual ही है कि organs अगर extra nodal या blood के अलावा कुछ और organ involve हो रहे हैं then it is not favorable, otherwise it's favorable. Fab type L1 is favorable, L2 is not favorable. साइटोजेनेटिक्स बहुत इंपॉर्टेंट आते हैं यहाँ पे और इन पे क्वेश्चन ज्यादा आते हैं. ओके, वन थिंग इज हाइपर डिप्लॉइडी इज फेवरेबल एंड हाइपो इज नॉट फेवरेबल. सिंस हाइपर डिप्लॉइडी इज फेवरेबल तो कोई भी ट्राइसोमी आएगी ना वो फेवरेबल होगी. तो ऑल ट्राइसोमीज आर फेवरेबल. अदर देन द ट्रांसलोकेशन 1221 is favorable. Okay, again, translocation 922, that is PCR ABL is not favorable. So you have to know this कि 922 translocation in case of CML is favorable. 922 translocation CML में मिलती है तो it's very good prognosis. Otherwise in ALL it's a very poor prognosis. Okay. Time to remission less than 40 days is a favorable prognosis. More than 28 days is a not favorable prognosis. Okay. So all the best, guys. We have discussed these very important tables and we'll keep on discussing these important tables. So try to learn these tables by heart. Okay. All the best.